Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who had impacted earwax in both ears, and the cause of their impaction was the misuse of cotton swabs, Q-tips, or also in the UK they're known as cotton buds. The patient then attempted to self-clean the ear through a combination of using some earwax drops and also the shower head, unfortunately, and they were trying to flush the wax out using water, and it only served to further impact this wax right up against the eardrum. And that's why the wax is, in combination with using the drops, it's really wet and gooey and sticky. So we're just using microsuction here, we're just entering the ear, we're way beyond the second bend. This is right probably about a centimetre away from the eardrum, so in the latter third. And already we can see the eardrum in the distance. Now clinically, the patient can hear again, so anyone who performs clinical ear care, we've got, if you've been watching my channel, you may be aware that I developed this device, the iClearScope, and I also train people in the technique, and I've got a couple of training courses coming up tomorrow and Saturday. And I thought this is a good video actually to upload, because when a lot of the delegates come on the course, they watch my videos, and some of them think it's quite easy at the time, but when they come to have it when they're performing it, they realise that it's a lot more complex than they believed, and they're worried that they won't be able to remove every little last speck of wax. And I stressed to them that they don't need to worry. You don't, in terms of the patient's symptoms, because earwax removal is different to washing a car. When you're washing a car, you're trying to remove every little last speck of dust or dirt, a piece of mud on the car. Earwax removal is different. We're trying to remove, the purpose of earwax removal is to remove a substantive amount of wax whereby the patient can hear better and alleviate their symptoms. And we've done that already, and with experience and skill, and it's just performing procedure after procedure like I've done for many, many years. Then maybe you can start progressing and kind of remove some of these remnants. And even myself, there's times where, and you'll see it in this video, I left a bit because I don't want to risk injuring the patient over a little bit of wax that's just smeared and staining the ear canal. It's not significant, and actually a bit of wax is actually good for you. That's why we have earwax. Earwax is an evolutionary product. There's many thought of benefits of earwax. They include, earwax is slightly acidic, so the acidity of earwax is thought to help repel insects from entering the ear. So if you can imagine our ancestors, who used to sleep on the floor in caves, and you've got creepy crawlies lurking around. The wax was one school of thought anyway, so an evolutionary byproduct to deter and repel insects from entering the ear, the acidity. The acidity of earwax helps to inhibit selective bacterial and fungi growth within the ear, so it's almost an anti-infection property, antimicrobial properties. Earwax is quite oily. It contains sebum, which is a fatty, oily substance, the same substance is secreted by the hair follicles on our scalp, and also an oily sweat, the same sweat as under your armpits. That's if you have that specific gene mutation, that oily sweat. But this oil is designed to moisturise the skin. So the skin that lines the ear canal, it's a very, very thin layer of skin. It's an epithelial layer, so the outermost layer of skin. Towards the eardrum, the inner two-thirds, that skin is only less than 0.1 millimetres in thickness. So this oil is designed to moisturise the skin, preventing it from drying and cracking. And earwax is sticky, so any foreign particles, dust, dirt, pollen that enter the ear, they stick to this wax. And wax, for the majority of people, naturally migrates. I'd say about 90 to 95% even of the population. The wax is not problematic. The wax naturally migrates. And that's because the skin, you can see the skin here, normally the skin dies, and as it dies, it moves sideways, like a conveyor belt. So as the skin migrates, sheds the ear out of the ear, the wax sitting on the surface of the dead skin also comes out. So a bit of wax is good for you. I don't personally think this patient is, inverted commas, a waxy person. I just think on this occasion it's more self-inflicted, but because it's the first time they've had it, and they've just got a habit of using cotton buds, and we've all got these little habits, and I just recommend just to stay away from them because they do more damage than good. when to use a cotton bud. Now, if you're using it on the outer bowl of your ear, so there's little folds and creases, that's not, because wax actually does migrate out of the ear canal. It can collect in the folds and creases of your ears. That's okay. If you're just using it literally just at the entrance to mop up a bit of dampness or moisture, that's fine, but please don't push it into the ear, because over time you're going to be further impacting that wax deep into the ear. In fact, I had a client, I think it was today or yesterday, I lose track, but they purchased one of these online DIY home use endoscopes that connect to your smartphone in an attempt to try to remove wax themselves, and they've really impacted it against the eardrum. I'll try and upload that video tomorrow over the course of the weekend. And they really did quite well going that deep, actually, but instead of removing the wax, they pushed it right up against the drum, and it was causing the patient serious otalgia, so earache, and fortunately we were able to remove it and the patient's fine. So again, we've got the majority of the wax out. I can see the eardrum, the patient can hear. So if we did a hearing test now, and if we did a hearing test with the patient not having even the lightest speck of wax, there shouldn't really be any difference, because the eardrum is exposed, the sound can travel through. Even sometimes a little bit of wax on the eardrum is not going to affect their hearing. If it did, it would be so minimal that it won't even be detectable within our hearing test. When we do hearing tests, we test in 5 decibel intervals and steps. So it may not even show up on a standard hearing test. So again, I'm just going to try and mop up around the edge, just trying to tidy it up, but I think near to the end, the patient just got a bit of a caloric effect. They got a bit dizzy, so we just stopped and we left it. And you can see what I've done there, the tip of the end, the suction probe, I've just bent it. You may see that curvature right on the distal end, so the end furthest away. It's just to help to get a bit of access in the anterior recess. Now, on the outer third, where we are here, that's all cartilaginous. We can put a bit of pressure there, so that's not going to cause the patient any trauma or pain. So I'm just going to the roof, and I'm just hovering over. If it comes off, brilliant. The last thing we want to do is start scraping and putting too much pressure on the ear canal. So I'm just going back to the back part of the eardrum here, just hovering over. And you can see it came away with minimal resistance. And I think I'm more or less done now. Patient's got a nice healthy eardrum. They're aware to avoid water in the ear, because what they said is that they know people that have had their ears flushed out, irrigated, so they didn't think it would be a problem trying to flush out the wax themselves, which of course makes sense if that's a common treatment provided where water is flushed out. One can start to think that why can't we do this ourselves at home? But water is just generally bad for the ear, and sometimes if you get it wrong, it can just propel the wax further into the ear. It can literally jet wash it against the eardrum, and can be quite painful as well. You always run the risk of perforating the eardrum, more so when you're flushing water in the ear, and in addition, water can always lead to you developing an ear infection. So that's why I don't perform syringing. So a bit of wax around the ear, just left that. I hope you enjoyed that video, guys, and it gave you a bit of background knowledge about the philosophy behind earwax removal, and I hope some of the clearwax delegates are watching it, because it probably put them at ease. They're not quite often, I always say to them, less is more, so they don't get too anxious before attending tomorrow and the Saturday group. Well, take care, keep well, and speak to you all soon. Bye.